On the Medical Watch, a dramatic increase in overdose deaths.
Our medical reporter Dina Bair has more on how COVID is having an impact on fatalities, even when people were not COVID positive.
The pandemic took a toll on everyone. Some turned to drugs and alcohol in isolation amid COVID lockdown. Others who are already battling addiction fell back into substance use as they were overwhelmed with depression and anxiety. Health experts say with nearly 100,000 overdose deaths since the pandemic began, this is at crisis level.
We are obviously seeing a crisis in terms of overdose deaths, but I feel like that's just one piece of this. I think we're also seeing a mental health crisis.
Nearly 21,000 more people died in 2020, many accidental overdoses as people sought to escape the pain of pandemic.
Social isolation, also isolation with other people that live in the home, whether it be spouses or family members. I think there were other factors in terms of access to treatment. Even if people were able to access treatment, they may not have been comfortable accessing treatment because of health concerns.
In Illinois, the numbers follow closely with the national average of a 29% increase. Here in 2019, there were 2,687 overdose deaths. That number rose to 3,511 in 2020. That's 824 more people who died, a jump of 30.7%. The greatest increase across the country occurred in Louisiana, with 53.2% more people succumbing to overdose. Only one state, South Dakota, saw a decline, down nearly 5%.
This was happening nationwide.
A major factor, fentanyl.
Fentanyl is 100 times more potent than morphine. It's 50 times more potent than heroin. And I think what's important to know is that at this point, fentanyl is not just showing up in heroin to make it appear or feel more potent. It's getting put into cocaine, methamphetamines.
The solution, focus on mental health and addiction treatment as fervently as medical professionals are targeting COVID.
It's not just mental health providers that are seeing an increase in people trying to access care at this point. This is also falling on primary care providers, pediatricians, I would say all healthcare providers are being impacted in this because people are going to go to the healthcare provider that they trust and have a relationship with the most. If there was ever a time to get treatment for mood and anxiety symptoms, this would be the time to do it.
If you or a loved one are in crisis, there's help. We have links to a 24-hour helplines in both English and Spanish on our website.
All right, Dina Bair.